Hello, welcome to another episode of Arthritis and You, A Joint Journey. Today, we've got something special lined up, so buckle up because it's time for the deep dive. Let's give a warm welcome to our hosts, Arthur and Sarah.
All right, so we're going deep today.
Deep dive time.
We're talking methotrexate,
Yeah.
which, I think we all know. It's like,
That's a big one.
it's a big one for,
Rheumatoid arthritis.
Yeah, rheumatoid arthritis and a bunch of other,
A lot of rheumatic diseases.
yeah, rheumatic diseases.
Mhm.
So if you're taking it, you probably already know that.
There can be some side effects.
Yeah, the side effects, they can be a bit much sometimes, right?
They can be.
So we found this video.
On YouTube.
Yeah, on YouTube. It's from Alberta Rheumatology, so
Yeah.
shout out to them.
Mm-hmm.
And it's called, let me see if I can.
Ask the rheumatologist. How do you reduce methotrexate side effects?
Yeah, that's the one. So,
Very descriptive.
yeah, very, straight to the point.
Exactly what we need.
Exactly, which is what we like.
Mm-hmm.
So methotrexate, like, everyone always says it's like the gold standard.
Yeah, gold standard. It really is.
But,
it's effective.
Yeah, but like with a lot of medications that are really effective,
There are downsides.
there's got to be some trade-offs.
Unfortunately, yeah.
Yeah, and I
With
think
methotrexate especially.
it's the stomach stuff.
Yeah.
Like just, ugh.
Nausea, sometimes vomiting, and then...
And then on top of that, like, I feel like it's almost like having the flu.
Oh, yeah, definitely fatigue.
Yeah, just like
Muscle aches.
Yeah.
All of that.
Ugh.
Mm-hmm.
So in this video, they
They talk a lot about...
they talk a lot about kind of what you can do about it,
Yeah, and how to manage these side effects.
which is, I think that's really the most important part.
Absolutely, because, it's such a great medication.
Yeah.
You don't want to
If we can just figure out how to,
make it work.
make it work,
And for a lot of people, these side effects...
Is it even that bad?
No, they're very manageable.
Yeah.
And they kind of come and go, too.
They do.
They might be bad for a couple days after you take the medication.
It's usually like a day or two after, right?
Yeah, usually a day or two after you take your weekly dose.
The weekly dose.
Which, by the way, can be pills or injections.
Oh, that's right. Yeah.
So that's one of the first things they talk about in the video.
That makes sense.
It's like, maybe one form,
Works better.
is better for you than the other.
Yeah. That makes sense.
So
For the, for the tummy troubles, which I think that's like probably the number one thing.
Mm-hmm. Most common.
Yeah. Like, they talk about like pills versus injections.
Right.
And then they also talk about like the dosage.
Oh, for sure.
Like, obviously a higher dose.
You're gonna feel it more.
You can feel it more.
Yeah, and the thing about methotrexate is it's not like a one-size-fits-all dose.
Right. And I think that's something that a lot of people don't realize
Mm-hmm.
because they're so used to like, taking an Advil.
Right, taking the recommended dose.
Yeah. And it's like, one or two, whatever.
But with methotrexate, it really is tailored to the individual.
Yeah. It's very much like, what does your body need?
Exactly.
And I think that's something, to keep in mind too, is like, it's not your fault if you're having side effects.
No, absolutely not.
Like
That's very common.
it's super common, and it doesn't necessarily mean that the medication's not working.
Right, exactly.
It just,
You might need some tweaking.
yeah, it might just be a matter of finding like the right dose for you
Mm-hmm.
or the right form.
Right form, yeah.
Pills versus injections.
And even the timing of when you take it.
Yeah, that's right. They talk about that
It
too.
may make a difference.
Yeah, like some people, they swear by like, taking it before bed.
Mm-hmm.
Other people, they have to take it first thing in the morning.
Right.
And it's really just like figuring out what works for you.
Exactly. And that's where that open communication with your rheumatologist comes in.
Yeah. Which, by the way, if you are taking methotrexate, like, you got to be talking to your doctor.
Oh, absolutely. Yeah.
Like, don't just suffer in silence.
Especially with something like methotrexate, where there are so many different ways to, manage those side effects.
Yeah. And they're always like researching new things too.
Oh, all the time,
Yeah.
so.
So it's worth checking in with your doctor regularly, even if you think things are going okay.
Yeah, just to make sure that you're still on the best possible
Treatment plan.
Yeah, treatment plan for you.
For sure.
So they talk about a couple other things in the video too that I thought were really interesting.
Oh, yeah.
So folic acid, which I think a lot of people who take methotrexate are probably already familiar with.
Right.
But apparently adjusting the dose of that can actually help with the side effects.
Yeah, and some rheumatologists will even recommend adding vitamin B12 alongside the folic acid.
Really? I didn't know that. Yeah, it can help with kind of like the cell production and stuff that methotrexate can sometimes interfere with.
Wow, that's fascinating.
It's kind of a newer thing that some doctors are recommending.
Yeah, and again, like, you should definitely talk to your doctor before you start taking any new supplements or anything like that.
Oh, absolutely.
But I thought that was, like, really interesting.
Yeah, no, it's good to know about all the options.
Yeah, exactly. And then, okay, this one, I thought this was, like, really out there.
Okay, I'm intrigued.
Cough syrup.
Cough syrup.
But not just any cough syrup.
Okay.
It has to have DM in it, which is, I looked it up, it's dextromethorphan.
Dextromethorphan, yeah, so that's interesting because dextromethorphan actually works on a specific receptor in the brain that can reduce nausea signals.
Oh, wow.
Which are often triggered by methotrexate.
So it's like blocking the nausea signals.
Exactly.
Wow, that's amazing.
Yeah, it's not something that everyone will need or that will work for everyone, but...
Right, but it's like another tool in the toolkit.
Exactly. And I think that's what's so important to remember with methotrexate is that there are a lot of different tools.
Yeah.
And it's about finding the right combination for you.
Yeah, and your doctor can help you with that.
Absolutely.
Like they're the ones who, have all the knowledge and the experience to kind of guide you through that process.
And they're also the ones who can monitor you.
Yeah.
And make sure that, everything's going okay and that you're not having any, like, unexpected side effects or anything like that.
Right, exactly.
So, yeah, like you said before, like, don't suffer in silence. If you're having side effects, talk to your doctor.
Yeah, because there's almost always something that can be done.
Almost always. Yeah.
Whether it's adjusting the dose or trying a different form of the medication or adding in one of these, like, other little things.
Or even just, like, changing the time of day you take it.
Yeah, exactly.
There's a lot of different things to try.
So don't give up on methotrexate. Absolutely not.
Just because you're having some side effects.
It can be such a life-changing medication.
It really can.
For so many people.
So work with your doctor. Find what works for you.
Mm-hmm.
And yeah, I think, one other thing that I was thinking about, and they didn't actually mention this in the video.
Okay.
But, like, have you ever thought about, like, joining a support group?
Oh, like an online support group?
Yeah, like an online support group or a forum.
For people taking methotrexate.
Yeah.
That's actually a really good idea.
Right.
I hadn't thought about that.
Because I feel like...
Because there are so many people out there who are taking it.
Yeah, and they're all, like, dealing with these same things.
Right, and they probably have all sorts of tips and tricks.
Yeah, and just, like, the shared experience.
The shared experience, for sure.
Like knowing that you're not alone.
Yeah, that can be so helpful.
Yeah, so, I don't know. Maybe that's something to think about.
Yeah, I would definitely second that. Yeah. All right, so methotrexate. It's a powerful medication.
Mm-hmm.
It can be a little bit tricky sometimes.
With the side effects?
Yeah, the side effects, but...
But there are ways to manage them.
There are ways to manage them. Don't give up. Talk to your doctor.
Absolutely.
And maybe check out some support groups online.
Yeah, good idea.
All right, that's our deep dive for today.
Deep dive complete. We'll see you next time.
See you later.
This has been another episode of Arthritis and You, A Joint Journey, brought to you by the Rheum team from albertarheumatology.com, your trusted evidence-based suite of resources available 24/7. Straight from Alberta, but for folks around the world. Our hosts today, Arthritis and Sarah Upis, technical producer, John Ifan, and our executive producer, Stephen Cates. While we work hard to maintain the accuracy of our information, we accept no legal responsibility for any errors or omissions. Remember, always check with your own physician first. Join us next time for another Deep Dive.